I'm going to start recording now. So, first things first, does anybody have any questions or anything? I can turn your microphone on. As you see, I've got some new equipment. I've got a new microphone, got a new webcam. So, back in business. So, I tell you what, I'll turn your miphones on. Does anybody have any questions then before we get started? And I'm recording this now. So, anybody got any questions?
Hi, Kevin. Just say hi.
Hello, hello. You got any questions, Ensima?
Just please start. While you start, I will have some question. At the moment, no, thank you. Just I will go.
Okay, well, I shall do as you say then. I'll get straight on. Let me do a screen share. Let's have a look at these letters then. Letters for today. Now I've got 6 letters. Got 6. Let me have a look at these. I don't need those. I can see that. Okay. So your letters first. What a surprise. Okay. I'm writing to refer Mrs. Potter, whose signs and symptoms are suggestive of severe osteoarthritis. Right. Now, I would take that article out. We don't actually need that. So, severe osteoarthritis here, it's a condition, yeah? So we don't need an article there. Whose signs and symptoms are suggestive of severe osteoarthritis in the left knee. Surgical evaluation. Okay, no, right. Now, there's too many clauses here. With too many clauses, I'm writing to refer Miss Potter, whose signs and symptoms are suggestive of severe osteoarthritis for surgical evaluation and the possibility, because it's a definite possibility, of a knee replacement operation. Okay, you could do it like that. But then again, if you do it like that, then whose signs and symptoms would be a non-defining relative clause. And we really need this information. It should be a defining relative clause, essentially, because this is important information, you know. So you could do, I'm writing to refer Mrs. Potter for surgical evaluation and the possibility of a knee replacement operation. Then second sentence, she has the signs and symptoms, or she has been diagnosed with, etc. Okay. Now, I don't have the case notes for this. I can't remember if it was asking, if you were asking the reader for a definitive diagnosis or not. But surgical evaluation. Okay, regarding her medical history, Mrs. Potter has had osteoarthritis since 2008. Well-controlled hypertension, intermittent urinary, I think it's a urinary tract infection. And the last, not the least, well, you wouldn't put that there. That's hardly factual or clinical writing, is it? You know, and last, not least. So you don't, you know, I wouldn't use that at all. I just put a comma and insomnia, and we don't need that because that is not factual or clinical. Her medications are Ramipril, 5 ml, Pandasol, blah, 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 blah. Okay. On the 23rd, Mrs. Potter presented with a complaint of a sharp pain in the left knee during walking, which also persisted at rest, not persisted at rest as well. I would put that there. Okay, in addition, she felt a mild pain in her right knee while moving. So you've got a sharp, it's like, that's virtually identical though. So she's got a sharp pain in her left knee, which continues when she's not walking, but there's also a mild pain in her right knee while moving. So I would put both of those in the same sentence because it's kind of the same thing. You know, she's pains in both her knees, sharp in the left, mild pain in the right, etc. It should be mentioned. Well, why should it be mentioned? There's no need to say it should be mentioned. Just simply mention it. During walking, I mean, I would have probably, right. So, as I've mentioned before, grouping like or similar information together. Okay. So, why do you have the pain in the left knee? Oh, and then there's something in the right knee. Oh, and back again to the left knee. Why would you do that? That doesn't really make a lot of sense in terms of logic. Wouldn't it be better to put all the left knee? She's got the complaint of a sharp pain. She's had this since last year. It's become more intense and it persists even at rest. Put all that information in one sentence. Additionally, in addition, she also has a mild pain in her right knee, you know, etc. So what I would do there, instead of breaking it up, left knee, right knee, left knee, put all the group of like-minded information together, right? On the examination, there was tenderness, my left knee with limited joint movements or joint movement. As a result, an X-ray and blood tests were requested. She was prescribed. Well, it's not also, you know, she was simply prescribed, not also. She was prescribed with naproxen. Okay. Today, Mrs. Potter's X-ray revealed. Now, again, I wouldn't use an indefinite article there. Mrs. Potter's X-ray revealed acute osteoarthritis because it's a condition, so we don't usually count it. We don't usually have it as a countable noun. With the presence of osteophytes and diminished, don't need the article, left knee joint space. Therefore, the analgesic dosage was increased. Who increased it? Did you increase it? Then why not say so? And she was referred to physiotherapy sessions. Oh, sorry, I've been up since 4, so you know, and it's 3, just after 3 now, so it's been a long day. In view of the above, I would appreciate your assessment and treatment, Mrs. Potter, blah, 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 blah. Okay, so not too bad there. So you don't need articles for a condition. So no acute osteoarthritis. We don't need one for left knee joint space because diminished. Okay. And an X-ray. The possibility of a knee replacement operation. Okie doke. Okay, on to Sonia's now. Writing to, how much time do we have left? 30 odd minutes, okay. I'd like to refer this patient who has a preliminary diagnosis of an initial stage of liver cirrhosis and who requires expert consultation. Well, I would imagine that we can presume or assume that he's an expert, so we don't really need this. We don't really need to say your expert's consultation. We don't actually need that, you know. So I am writing to request your assessment and your consultation. So who's consulting? I mean, usually, you know, you consult the consultant. Yeah. So you send the patient to the consultant for assessment. You know, so I'm writing to request your assessment or your consultation, or I would like you to arrange a consultation of Mr. Berry, who has, etc. Okay. On his initial consultation week before, Mr. Berry reported to a history of fatigue, on which appetite increased susceptibility to bruising. Okay. Abdominal tenderness, seats, and extension. Consequently, Well, consequently or subsequently, because as a direct consequence of, but you know, it happened afterwards, so I would use subsequently. An abdominal ultrasound and function tests were requested, and he was advised regarding a balanced diet. What does that mean? What? So you advised him to start eating a balanced diet and cessation. Well, you don't really say that. You must cease. You must cease smoking and drinking. You simply say you've got to stop. You know. Consequently, so and so were requested, and he was advised. Okay, balanced diet, cessation of smoking and drinking. Also, he was offered a nicotine. Right now, I wouldn't use that article. A nicotine replacement therapy, because that's therapy in general, such as a surgery. It's a, you know, we don't usually count it. However, a referral we can count. Okay, so a referral to an alcohol support team. Upon today's review, although he's reduced smoking, his alcohol intake is still high, and he has seen no improvement in his condition. His pathology report showed a derangement of liver function tests. The presence, I put a definite article there, of hepatosplenomegaly, if I've said that right, and a posterior hepatic notch on the ultrasound. Regarding Mr. Berry's medical condition, he had hepatitis C 2015, treated successfully. Also, he still has, you know, because he's not dead yet, so he still has a history. Also, he has a family history of hepatic cancer related to his ulcer. Okay. In view of the above findings, it would be appreciated. Who would appreciate it? It would be appreciated by whom? I would appreciate it if you could further assess the management of Berry's condition. That's pretty good, Sonia. That is, you know, that's pretty good. No real comment there. That's quite good. Jansu, let's have a look. I copied this out, so it's hang on. Let me just space this out a bit. Okay. Oh dear, what's this sentence? My favorite sentence. Would highly be appreciated. Well, actually, it should be would be highly appreciated. But why would it be appreciated? By whom would it be appreciated? There's no need to highly appreciate anything or anybody. Medical professionals, they do their job. You don't have to highly appreciate it. I'm sure Miss Jones would highly appreciate it, but you know, I've never seen this sentence in any of OET Online, Swoosh, E2. I've never seen this in any of their example letters. So I don't know where you find it from. So I'm writing to refer Miss Jones, your urgent assessment would be highly appreciated. Or I'm writing to request your urgent assessment of Miss Jones. And signs and symptoms are suggestive of ectopic pregnancy. You can do it in a single sentence. If you've watched any of the OET videos, what they want is conciseness. That's what they want. They want it to be concise. They keep saying, Rebecca, I shared a couple of her videos in the channel. You've probably seen them. And she's always talking about concise. Healthcare professionals don't want to be reading lots of blah, blah, blah. I want you to do X, Y, Z because X, Y, Z. That's it. That's what they essentially want. So I would try and keep that in mind. On 15th of a second, she presented to my clinic complaining of lower abdominal pain. The pain was started. The pain had started. Past perfect. The day before, worse. What? Day before and was worse in the right iliac fossa. She reported no history of bladder bowel symptoms. Well, that sentence doesn't seem any, you know. She presented, so I would put the name, you know, right, so, okay. Miss Jones presented complaining of lower abdominal pain, which had started with, so So let's make this a bit more concise now. Okay. Miss Jones presented to my clinic complaining of lower abdominal pain, which use a relative pronoun, which perfect had started the day before and was worse. Am I right? If also. However, showing a contrast, she reported no history of bladder or bowel symptoms. As she has been using POP, I would usually spell out abbreviations first use. For 2 months, she has had irregular bleeding, was unsure about her last, how do you spell it? Menstrual, not menstrual, menstrual period. Her abdominal examination was normal, except for some tenderness in the definite article, right iliac fossa. Vaginal examination, a vaginal examination, her vaginal examination. We're supposed to be making grammatically complete sentences here. Okay, keep that in mind. Revealed tenderness or a tenderness in the right phonics. She was advised to return in the morning for reassessment and a blood test or blood tests. If it's an abstract noun, you can make a plural form. Okay. Yesterday, her pain was worsened. Well, right, it was worse or it had worsened. So yesterday, did she not come in? When are we writing this? Is it not on the same day? So this is written on the 17th. She came in on the 15th, and you told her to come in the next day on the 16th. So why are you writing it the day after? Isn't it usually on the same day? Okay. Yesterday, so either yesterday her pain was worse or her pain had worsened. Additionally, she had slight vaginal bleeding and left shoulder pain. They examined left shoulder pain. Do we need that? Oh, okay. The examination revealed tenderness, or her examination, or upon examination, I found tenderness regarding a rebound of the right fossa. Pregnancy test results. The pregnancy test, her pregnancy test result was positive. Did you say anything about, where did you mention that? Where does it say anything about, so, right, where does it say anything here about her taking a pregnancy test? Now, I remember, I think from the case notes that she took it herself, but it doesn't say anything. It doesn't tell me here, did she take it at home? She came in and said, oh, I've had a positive test. Did she ask you for a test? Did you give her a test? And she came in, you told her. So it's not clear who performed what action here. So I would work on that. The pregnancy test result was positive, and urine and the urine dipstick was clear. And so what? You're not telling me any connection between these things. So, okay, her pain's worse, slight bleeding, positive test, urine dipstick was clear. So what you need now is to in view of the above, I believe Miss Jones has an ectopic pregnancy, and I would appreciate your blah, 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 blah. That would make more sense. So you have to restate this, right? So you need your reason for writing at the start. I'm writing to request, refer, blah, blah, blah. Okay. And you need to mention it again at the bottom before the closing. What is it that you want the reader to do? So here, okay, her pain worsened, the pregnancy test, blah, blah, blah. So in view of the above, I believe she has blah, blah, blah. I would appreciate it if you could, etc. Okay, that ties it in, makes it nice and neat. Okay, so not too bad there. See what we've got here. All right. I'm writing to refer this, well, why do you have the age here and then tell me the age again? It's repetition. Age 19 years, a 19-year-old girl, well, Emma, unless she's a trans whatever, we can guess that she's a girl. whose features are consistent with severe asthma. Okay, urgent assessment and management. So that's pretty clear in terms of purpose. Okay, I want you urgent assessment, management, this patient because she's got severe asthma. Okay, good. But we don't really need that about 19-year-old girl because you've told me this once. Okay. Miss Johnson presented to me initially with an, because you can count it, upper respiratory tract infection. On examination, the lung field was clear, but the peak expiratory flow rate 25 liters per minute. For which, oops, use a relative pronoun, for which she was treated with paracetamol and fluids. No need to have two separate sentences there. After 20 days, on the 21st, Miss Johnson complained of a persistent cough, or complained of having a persistent cough, although her other symptoms had subsided. On auscultation, basal wheeze was present. Okay, that's a very short sentence, very short, simple sentence. Right. So you could join these up, on auscultation, basal wheeze was present, and the peak expiratory rate was blah, blah, blah. She was started on a trial, you can count that, it's countable, of salbutamol 2 + 3 times a day. After 3 weeks, Miss Johnson had improved. Corticosteroid was added along with salbutamol in a treatment regimen or regime. How do you spell that? Regimen or regime, doesn't matter. And eventually she recovered significantly. Her peak expiratory flow rate increased, okay, 3 minutes. Okay. You could maybe change it, but it's not that bad. Upon today's review, Miss Johnson presented with breathlessness. Why is that capitalized? And wheezing. Well, it's not from, it's over or during the past 48 hours. From the past. Presented with breathlessness and wheezing over the past 48 hours. Auscultation, wheeze was present in lung field, or in her lung field, the lung field. We managed her with Ventolon nebulizer, but it did not provide relief. In view of the above mentioned instrument findings, your agent evaluation, etc. Okay, not too bad. Not too bad. What's this? Rashid. Okay. I'm writing to refer Mrs. Clark, who requires further investigations and assessments. Well, assessment, I suppose, of a possible bronchogenic carcinoma. Initially, Mrs. Clark presented with sore throat, but it's in cough, which she was prescribed augmentin. On a subsequent visit, her previous symptoms had subsided with the course of augmentin. Well, you don't need to repeat it. Just say her previous symptoms had. Mrs. Clark presented blah blah blah, for which she was prescribed augmentin, which eased her symptoms. On a subsequent visit, despite her symptoms having eased, she reported having a dry, non-productive cough for 7 weeks, which was associated with a mild shortness of breath and chest pain. A systemic examination was remarkable for signs of consolidation on the right chest. Okay. So the family history, right? I've seen this before. Now, the mother's cancer. Okay, but lung disease. So her father, it was a minor. So that's not genetic, though, is it? Because it's occupational. It's occupation related. It's like what do you call that shit? Emphysema kind of thing. Lung disease, breathing in coal dust, etc. So that's not genetics. I'm not sure if that's directly relatable in terms of history. It's interesting, but it's not a genetically passed down condition because he was a minor. Please note she's a heavy smoker. In light of the above, well, we usually say in view of the above, we don't usually say in light of the above. Terms of allocation. Kindly arrange for, in light of the above, I would like you, could you please make it polite? Could you please, could you kindly? There's no need for this kindly, what, as opposed to what? Unkindly? He's going to unkindly arrange. So just, you know, could you please arrange further investigations, including a biopsy, for establishing a definitive diagnosis? Okay. I would have put the definitive diagnosis right at the start. I'm writing to request your assessment of Mrs. Clark, or I'm writing to request your assessment and definitive diagnosis of Mrs. Clark, whose signs and symptoms are, etc. You could do it like that, and it would be a bit more concise and to the point right from the start. That's what we want in terms of purpose. But not bad, Rashid, not bad. Okay, Amgad, what do we have here? Have I got time? How much time have we got? 10 minutes. Okay. Ah, good. I'll finish this and I'll have time for a few questions. I'm writing this letter in reference to Miss Taylor. Writing this letter, well, we know it's a letter. It's in my hand. You don't have to tell me it's a letter. I am writing concise. That's what they want. I'm writing reference to Miss Taylor. Now, you don't need this full stop if it's Mr., Mrs., Ms. You don't need it. Only if it's an abbreviation, Admiral, Superintendent, Captain, etc. Okay. I'm writing in reference to Miss Taylor as being discharged today from our hospital into your care. She would, what's this? Thus your further continuous, right. Well, thus, nobody uses thus, therefore, thus. So your further continuous follow-up will be highly appreciated. So why do we have 3 sentences in this introduction? What is it you want me to, well, me, the reader, to do? I am writing to request your continuous care of Miss Taylor, who is being discharged from our hospital today following an episode of schizophrenia. Okay, a single sentence. You don't have to make it 3. And why would it be highly appreciated? So, 10 minutes left. Let me just turn that. Okay, why would it be highly appreciated? Why would it not just simply be appreciated? Again, I've never seen this in any of the other samples. I don't know where you get it from. On the first, Miss Taylor was admitted to a psychiatric department. She was initially agitated and aggressive. Oh, this is the long sentence. Okay. Miss Taylor was admitted. Isn't this the one who self-admitted because she was doing coke the night before? I think so. Didn't she self-admit? She wasn't admitted. She wasn't brought in, as I remember from the case notes. She was self-admitted. Okay, psychiatric department. As she was agitated and aggressive, she has a complaint of internal stimuli. Did she actually say, I have internal stimuli and fault blocking and latency? I don't think she actually said that. That's not what she said. So that's what you may have found, but that's not what she said. Oh, I've got internal stimuli and fault blocking and latency. I'm sure that's not what she complained of. From the case notes, it says she was, she was having delusions. She thought she could communicate with political figures or something, and so that's what she actually said, not this. Okay. However, 10 days later, she stopped complaining of other hallucinations. Therefore, there was reduced disorganized thinking, and she was able to. How can you subside a delusion? How can you do that? How can you how can you be able to subside delusions? Can you do that? I don't think so. Her delusions subsided, but she wasn't able to actually control delusions. You will subside. That's not how it works. Moreover, she can focus on her daily activities. Why do we have this very short sentence? Shouldn't it be part of the previous sentence? You know, however, after 10 days, her symptoms subsided and her hallucinations stopped. Her thinking was better organized, and she could focus on her daily activities. Okay, while in hospital, the patient has been improving gradually. Well, this seems to be saying the same thing as the previous sentence. So, right, so you said, okay, on the first, she came in and she had blah, blah, blah. However, 10 days later, so this is like while she was in hospital. So she stopped complaining, reduced it, and she could focus. So then you say, while in hospital, she's been improving gradually. The patient was, so this is basically saying the same thing as what you've just said in the previous paragraph. Is it not? It's essentially the same. You know, while in hospital, the patient, so you could, you know, you could take this out, right? And then put that information here. While in hospital, the patient has been improving, she can focus on daily activities, she's no longer suffering delusions, etc. So it seems kind of repetitive, if you ask me. Miss Taylor was feeling well at the time of discharge. Well, she's being discharged today, so she's not being discharged yet. Isn't she being discharged? So why is it feeling well at the time? If she's not being if she's being discharged today, then how can you, you know, mixing times up? Thus, great care and follow-up are needed as the problem may relapse. Well, she may relapse. Her problem cannot. She can. Her problem doesn't relapse or do anything. It's a problem. It has no sense of agency. So great care and follow-up are needed as she may relapse, not relapsed. So an extra 1 milligram should be taken as PLN for agitation or psychosis. No mention of taking coke. I seem to remember something from the case notes that she's an alcoholic and she takes coke. So you don't mention anything about that here. Do you not think that would be worth mentioning, that she took coke before she came in? I'll say something about again, I seem to remember something from the case notes about she may relapse with alcohol and coke, and this may cause her, etc. But you don't mention anything about that here. Nothing about the drugs or the alcohol. I think that's in the case notes. I'm virtually certain of it. In fact, however, that being as it may, we've got 4 minutes left. 4 minutes left. So, who wants to ask me some questions? What you can do, you can raise your hand and I'll turn your microphone on. So does anybody have any questions? Anybody? I can turn your microphone on if anybody's got any questions. Just raise your hand, I'll turn it on. Somebody wrote a question, where should we put the history? It depends on the case, on the task. You can put it, right, Seema, hang on, man. Hello.
Kevin, hi,
Yep.
you hear me? Yeah, Kevin. Yeah. Kevin, I have a question. In part of one of the letter, one of, I think the second letter. So it said the patient presented complaining of something, or the patient presented with complaining. With should be there or not necessary? With complaining?
Oh, which letter are you talking about?
I think it was the one with the ectopic pregnancy, that letter, the patient
That's the
presented
third.
with,
That's the third.
oh, the third one.
Yeah, she presented either complaining of. Yeah, that's right. Or with, well, you know, some people put with the complaint of.
With the
Make
complaint.
it like
Okay.
a noun, you know, with the complaint of X, Y, Z, or you can make it like a verb, complaining of.
So no need with, if we say complaining of, no need with before that, with complaining of. With is not necessary.
No. Usually,
just complaining
yeah,
of.
usually.
Okay.
Well, I didn't actually change it. I'm looking at the text now, so you can say, you know, people, you say with the complaint or with a complaint of, presented with.
Okay.
Okay.
Sure.
With the, so it's usually with the complaint of or complaining of.
With,
So,
with the yeah, okay. That was, I was not sure which one is. Okay, whether with the complaint as a noun, or if it's the gerund, no need with. Just presented complaining. Okay.
It's a verb, complaining of.
Okay, complaining of.
If it's a noun,
Okay.
with the complaint or with a complaint.
Okay, with the complaint. Yeah. Okay.
Anybody else got any questions? And it doesn't seem so. Okay, well, if nobody's got any questions, then I've got other things to do, so I'll end this here. I'll put the video on YouTube once it's processed. I don't know if this is any better. I've got a new camera and a new mic, so you have to let me know if you think it's improved the quality or not. We will see. It doesn't look so sharp on this monitor because it's meant to have like a auto focus. It doesn't look as good as I was anticipating. But anyway, we'll see. So anyway, that's will do for today. I'll probably have another session tomorrow because I've got time. I've got time every day this week. I don't have a lot of work on. So I'll see you probably tomorrow then, probably at the same time, more or less. Okay, right, I'll see you later then. I'll stop this and bye for now.